Hey, what's good, YouTube? I hope that everyone's having a good week. I'm doing a quick update since I meant to do it a week ago when I was officially 1 month post-op. Unfortunately, I have failed you all. So, I am currently 1 month and 2 weeks post-op and 17 weeks and 2 weeks on T. I want to do a recap on my surgeon. I'm not going to go into a lot of specific details about everything right now, but I'm going to go into as much to keep the video at a good length. Anyway, my plastic surgeon, top surgeon, was Dr. Cori Agarwal in Salt Lake City, Utah. She works at the University of Utah as an assistant professor in plastic surgery, as well as she's done plastic surgery in private practice. Overall, she's been doing plastic surgery related items for over 20 years, and she's been doing top surgeries for probably 10 years, if not a little bit more. I'm not remembering exactly the time frame that she told me, but I'm pretty close. Outside of that, my experience with her and her staff was amazing. I would recommend her to anybody. All of her staff, from the first day that I officially met Dr. Agarwal and the medical assistant that assisted me that day, the day prior to surgery, super amazing, and she was super friendly right off the bat. Like, you could easily talk to her about anything, any concerns, any questions that you had. She was super open about answering anything and everything for you. She did tell me that she was going to use my pictures, my before and after pictures, for classroom-related items. So she's going to crop my head out so that way they could just see my body before and after, which is cool. I was fine with. That kind of makes sense on why she doesn't have any photos up on the University of Utah's website on the surgeries that she does. She doesn't have any photos. And I never asked for any. But I'm sure that if you were to ask, she'd probably get them to you to take a look at some results. But she does use the pictures for classroom purposes only. Outside of that, her expectations and her step-by-step instructions that she gave me the day before surgery was spot on. Nothing went haywire at all. Everything went so smooth. The day of surgery, you go up to the University of Utah's hospital. And then they have a surgery center that's down a little bit farther from the hospital. So there are two different spots. But I know there's been some talk about some hidden fees with some other surgeons kind of here and there, depending on where they do their surgeries at. And I didn't pay anything extra. I didn't pay anything less than what she told me. And that's probably due to her using the resources on University of Utah's campus, and which kind of helps make her a little bit cheaper than some. She has a range between $4,600 and $6,600 dollars for any top surgery. Because my one chest was larger than the other side, and I did a double incision based on her recommendation on my chest size, even though I wanted keyhole. But she said that wasn't ideal for my chest size because I did revision within 6 months to a year, and I didn't want to go through anything else again. I didn't want to go through 2 surgeries in any way, shape, or form. So I said, alright, I'll go through the double incision, and if it's really bad and I still don't like the scars after a year or 2, I'll just get a chest piece tatted on me. So she was excited to kind of hear that news, since a lot of her patients have said that they were going to do that and never have, but so we'll see what happens. She does use drains, which some people like, some people don't. Dr. Raphael, I've heard, no longer does drains for whatever reasons, but anyway, I don't know much about that. But he doesn't use drains, so I've heard, which leaves you without like the little scars right below your double incision scars. Anyway, the day of surgery, each staff person that was going to be performing my surgery came and introduced themselves to me individually so they could answer any questions I had or concerns I had about what they were going to be doing and what was going to go on. I met the anesthesiologist. He's been working in medicine over 20 years. My pre-op and post-op nurse working in trauma-related sections of hospitals for over 20 years before going to the University of Utah. The nurse that was in surgery, in the surgery room, had been doing trauma-related items at hospitals for over 10 years. And so I was in really good hands. And Dr. Agarwal came while I was getting all ready, hooked up and getting all changed and everything to re-walk me through everything and see if I had any questions that might have come up overnight or any concerns that might have come up overnight about the surgery. And I said I didn't have any. She explained everything really well, so I didn't really have anything. She covered everything precise, clearly, you know, expectations, and I really felt I was in good hands overall. And the staff was super friendly from top to bottom. They treated my friend AJ that I went with super awesome. He said they checked up on him every like 10 to 15 minutes, gave him coffee that was available, gave him some snacks that they had available as well, which I don't know. And they just had some extra stuff laying around there trying to get rid of. Whatever, he took it. He was happy with it. And they apparently thought he was my boyfriend, which we were both fine with. I don't really care. And they were apparently okay with that too. So, we joked around, got serious, and they were just super friendly, super open about everything. Pronouns were spot on. There was no awkwardness with pronouns, because I hear in some cases people have had awkward experiences with nurses and doctors with pronouns, and no. They were on it like that. They called me he all the way through, and they treated me with such respect, and asked me, Dr. Agarwal had asked me how long I've been on hormones, and she offered to write me up a letter for having surgery, help me change my driver's license. She's already got a form already set to go, and she's like, just let me know if you need me to do it, and I'll sign it, blah, 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 blah. I was like, all right, cool. Well, I'm supposed to see my doctor for hormones soon, so I don't think I'll need it, but I'll let you know. I just started thinking recently that I was going to get it just in case, to have it with me, just for my personal records. But she said she would get it to me whenever I needed it, or felt like I needed it. My first week I didn't do anything but lounge around on my couch and on my back when I slept propped up. I did have to wear a compression vest with all the gauze and everything. I did go back a week later to have all the stuff removed and the stitches removed off my chest. And a couple of my other friends went along, and nothing had changed. Super friendly towards them. She made sure to direct anything that she told me towards them, just in case if they were going to be around helping taking care of me, to make sure that they understood if they were going to help me. So that was cool. They did the same thing with AJ the day of surgery as well, and while I was in recovery. Everything in total, my surgery is 2.5 hours, and I was in recovery for a half hour, which is super awesome. I was in there for an excruciating amount of time, which is good. And then Dr. Agarwal said that she was available phone, email, whenever I needed her, so just to hit her up, since I don't live in Salt Lake. That's how I could get a hold of her, and then if I was any concerns, to go to any emergency room with any crazy bleeding. But that didn't happen. The drains were the only thing that were annoying for me, and having to drain them twice a day. I'm sure there's some other stuff I want to cover, but I'm not remembering off the top of my head, so if I do, I'll make another video for you guys. And so without further ado, I'll show you my chest. Keep in mind that my left side over here was slightly larger than my right side, so the scar goes up inside my armpit a little bit longer than my right side, as you can see there. And she does tuck them up into the armpit to prevent dog ears. And she did nipple grafts, obviously, and she did a really good job, in my opinion. So this is what it looks like here. Right here, there, and there are the drain marks. This side is a little bit wider up in this area compared to this area, but not by much. Everything is pretty much even. This side is a little bit more red as well. But everything seems to have gone good. This, as I said, this side was longer, so the scars are a little bit longer than this side. But let me kind of get up close here. Here's my right side once again. looking at it. Here's the left side. Here's me without my arms up. Some like boob flexing for you, everybody. So that's what it looks like. Everything went really well. So no cause for complaints or issues so far. So I do have another follow-up with Dr. Agarwal here before school starts, anywhere between now and the 25th of August, so I will be updating you guys again. I'm sure if there's anything new or to go over with anything. If you guys have any questions, definitely hit me up, and I would love to go more in depth with any questions that you do have in any way, shape, or form in regards to top surgery, Dr. Agarwal herself and her staff, or anything else you guys want to talk about. Alright, I'll check you guys later.